Good afternoon. Thank you so much for joining me for this webinar on the United Health Foundation Diverse Medical Scholars Program. My name is Tanikia Jackson, and I am the Programs Consultant at the National Medical Fellowships. I have two other people that are on our programs team, including Desiree Torres, who is our Programs Coordinator, and Ellie Ogai, who is our Programs Associate. And altogether, we support the scholarships that we award here at National Medical Fellowships. So to give you a little bit of information about NMF, we are an organization that is located in New York. We were started in Chicago, but it moved to New York after a while. And we are almost at our 70th anniversary, so 70 years of awarding scholarships and providing opportunities to minority doctors. So the mission of NMF is to increase the pipeline of physicians and health professionals who have the professional knowledge, cultural competency, and commitment to provide quality health care to all members of our diverse society. The ways in which we do this is to offer scholarships, which are just monetary awards to underrepresented minority medical students, to offer service learning programs to students, and to partner with national and regional organizations such as the United Health Foundation. I want to take a moment to focus on that partner with service learning, on the part about service learning programs. So the difference between a service learning program and a scholarship is that in addition to the monetary award that you receive, you also have to do a 200-hour community service project. So as I said, NMF is committed to serving underserved communities, and this is one of the ways that we do this, by empowering our scholars to be able to serve those those communities. So this program does this in several ways. It invests in underrepresented minority health professionals and communities, develops future leaders in the medical field, such as yourselves, promotes community involvement and the habit of medical professionals being involved within their communities, and also supports community sites and their constituents. For the United Health Program, each scholar receives a $7,000 award. This year, we are awarding 30 scholars, which is up from last year where we awarded 22, and it is awarded to students who meet the following criteria. You have to be a U.S. citizen, identify with one of the following underrepresented minority groups: African American, Latino, Native American, or Asian American, and specific to Vietnamese or Cambodian for Asian American. You have to demonstrate leadership at an early stage, have a commitment to serving medically underserved communities, be enrolled in an accredited medical school, and attend medical school in one of the targeted locations. And I will go over those targeted locations in just a moment. But before I do that, I just want to point out that one of the unique things about the United Health Diverse Scholars Program is that once you are a scholar, you are eligible to renew your award, and it does still carry with it, you have to continue that service learning project. So the locations that we are targeting for this year, again, this is an area that we have expanded in, but we are doing Arizona, specifically in Phoenix, Florida for Orlando, Tampa, and Greater Miami, Georgia, we have Atlanta. For New Mexico, we have Albuquerque. For New York, it is the greater metropolitan New York City area, which includes not only the 5 boroughs, but also Connecticut, areas in Pennsylvania, and areas in New Jersey. Tennessee, we're looking at Nashville. For Texas, we're looking at San Antonio. And for Wisconsin, we're looking at Milwaukee. And you do have to attend school in one of these areas. Your project that you hold would have to be done in one of these areas as well. These are the areas that United Health has identified as being medically underserved that they would like to see a change in. The Community Health Project. So as I said earlier, it's a minimum of 200 hours in duration. It is also a self-directed project. And when I say self-directed, it means that the student has to set the goals for the project. So you cannot go and volunteer at at a place's project that they already have, or a program that's already going on. You have to have your own goals within that. So you could add to a project that they're doing, but you can't just volunteer with something that's already going. And then it has to reach an underserved community group. Again, going back to NMF, the ways that we complete our mission. So with the 200 hours in that, we do count the time that you spend planning for your project as well as the time that you spend meeting with your site mentor. That goes towards the 200 hours. The time that you spend reporting on what you have done does not count towards the 200 hours, so that would be separate. Here are some project examples from previous years. Reducing the risks of psychiatric medications through patient education, tackling health disparities for women in the inner city, a health plan marketplace project, and Cascade, which is a mini med school initiative. So one of the things that NMF has made available to people who are interested in our scholarships are the presentations for some of the projects that we have done. So if you go to our website, nmfonline.org, let me wait a moment for the computer to catch up. All right. So it's taking us to the website, and on there we have what we refer to as our resource library. And the resource library, as I said, is a list of the projects that have been done within a program. We also have it for several of our other service learning programs. So if you don't see a project that appeals to you within United Health, you could visit one of the other tabs and see what people have done in other locations. All of them are focused on servicing an underserved community and would meet that requirement that United Health sets. So this is the page that you would go to. This one, again, is specific to United Health, and it has our scholars from 2014 that are up now, and we will be putting up the ones from 2015 as well. So if you click on the first one, which is Lanice Bowens, it brings up the PowerPoint presentation that she did at the end of her program. And this presentation gives an overview of what her goals were, how she approached the problem, the site that she worked at, and her findings. It also talks about the conclusions that she drew at the end of the project, and some of them will also give information on struggles that they ran into and how they overcame those as well, which can be really significant when you're looking at planning your own project. So I encourage you, if you do not have a project in mind yet, to check out our resource library, see if you can find a project that appeals to you. So the program elements. I mentioned a site mentor earlier, and that's a person who is at the site who can help you both with navigating the site and figuring out the logistics on how you will run your program, and then also they should have insight into the topic that you are addressing so that they can give guidance as you go along. Monthly reporting. Each month you'll have to just report on the progress that you have made, what activities you've done with your participants, the successes that you've had. Again, it's a great place to notate the struggles that you've had as well. And that will be submitted online through a site that NMF has. And one of the great things about monthly reporting is that it helps you to keep track of what happened. So at the end, when you do your final reports, you have a guide that you can look back on in order to make sure you put in everything that you want to, and you're able to highlight the successes, the failures, the lessons learned from your project. So that includes a paper, a presentation, and a poster. and we have templates for all of those, so we make it pretty easy for you to do, but of course, you know, you have to bring the information from what happened. The culminating event is an opportunity for you to meet the other scholars that are in the program. We bring everyone together. Obviously, we are reaching a number of locations across the United States, but for the culminating event, we bring everyone together and you talk about your projects, you are able to share ideas, you're able to kick around, again, the issues that you face and to find other solutions that you may not have thought of before, and to really begin to create a network of people throughout the U.S. who are interested in similar things as you. Then we also have, specific to this program, the United Health Foundation Forum. And this forum takes place in Washington, D.C., and all of the scholars that United Health supports are invited to this forum. That includes not only you guys as medical students, but also United Health awards undergrad students as well. And they bring everyone to DC for an opportunity for enrichment and also building that network of doctors and being able to talk and kick around ideas with the community. The application is available online if you go back to our website. All right, we can just go from here. If you go back to our website, then this is the page that you would go to read more if you need more information on the program, as well as you would click here to apply for it. The deadline for this program is September 10th. It is approaching quickly, so if you have not started or finished your application, today would be a great day to do that. And again, we also have links to our resource library here, another link to the application, and then the application checklist, which takes you through each part of the application, which we'll also go over quickly right now. So things that I would like to highlight, a lot of this is self-explanatory, but the financial aid transcript, that is a form that NMF has devised, and the way that you submit it is when you're filling out your application, there's a form for you to enter in a contact from your financial aid office. You would put in their name, I believe their phone number, and their email address. That triggers an email to be sent from our platform to the financial aid person that you have nominated, and they can fill it out and then submit it to the site. So there's no need for you to go in and take the form to them. They will automatically get it through the workflow we set up on our application site. The personal statements are where we really are able to see your commitment to leadership as well as your commitment to serving the underserved. As I have noted several times, that's really important to NMF as a whole, and so we want to make sure that our scholars have those qualities at their heart as well. The community health project proposal, so you should have an idea of your project and where you're going to hold your project prior to applying, because you will have to put it in your site. You'll also have to put in the person you're thinking of as your site mentor, and again, a proposal for the project. While we don't expect that will be exactly what you do, we want you to have a good idea, and we may give you feedback on your project if we think that it needs to be tweaked in some manner to make sure that it's viable and that it's something that you can do within those 200 hours that you have set to complete the program. Your CV is another place that we look in order to see if you are a leader, if you've been active in your community. And then the letters of recommendation. One of the letters should come from your school dean, a faculty member, or and a person on the staff, an executive staff member of the school. And then the second letter should come from a person who is at a community site that has supervised you. And then the documentation of loan history can come through the NSLDS website, which I know I just said a lot of letters, but it's on that page that has the application checklist. There's a link to it there, and it's tied to the loan history element. All right. once again, the deadline for this program is September 10th, and the members of our programs team are Desiree Torres, Tamikia Jackson, myself, and Elio Guy. Elio Guy is our first point of contact, and if you email our scholarships at nmfonline.org, then she's the one who will respond to you, and she will either get you to the right place or she will respond to your questions. All right, so we have now reached the point in our session for questions. If anyone has questions, if you would type them into the chat box, I'd be more than happy to answer them. All right. Well, we don't currently have any questions. I want to thank you guys again for joining us for this information session, and I want to let you know that we will be sending out a survey that will ask you about how the webinar experience was for you, and we would love to get your feedback. It will help us to improve both the webinars that we are offering and also our scholarship process as well. So thank you for joining, and I hope that you all will apply. Have a great day.